Hi, my name is Alexis Thompson. I am a health educator with the Florida Department of Health. My presentation is just going to be probably a little different than the other ones that you've seen today. I do work with a lot of the statistics and epidemiology, but with that information that we get from lovely scientists like you all, I help implement some of the programs to lower those health disparities. So we're going to talk about some of the health disparities that we see in adolescents and young adults. I'm so used to talking to middle schoolers and high schools lately and having it really interactive. So if I start throwing my hands and stuff, it's just because that's what I'm used to in life right now because of COVID. So like I said, a sexual health educator particularly, our program is based for young adults 11 to 19, and our program is called Your Life, Your Health, Your Future. So what we do is we try to give young adults the best tools to make the best choices for their future. So adolescent health, it's kind of broken down into two subcategories. So adolescence is technically ages 10 to 17, and then young adults is between 18 to 25. Like I said, we cover 11 through 21-ish age, so I kind of cover both subgroups, but they make up about 22% of the population. So it's really important that we focus on the next generation. And even though adolescents and young adults are typically healthy, they are more susceptible or prone to some things depending on multiple factors like the social determinants of health that previous speakers have talked about, right? So they could be more prone to mental disorders, substance abuse, smoking, nicotine use, maybe nutrition and weight conditions, eating disorders, homelessness, sexually transmitted diseases, unplanned pregnancies, dropping out of school or having problems in academics, motor vehicle accidents, suicide, homicide, all these things that we see and we cover when it comes to adolescent health. And so a lot of times we don't think of young adults as, adults yet, right? But there are so many things that determine the decisions that they make. So yeah, school is something that we always think of, but there's multiple other things besides family. There's friends, bullying, their mental health, right? Especially with COVID, that's a concern for a lot of us working with young adults. Substance abuse, right? So all these things are always coming together when it comes to adolescent well-being. And so if we give them the right tools to make the right decisions, some of those adverse effects in their health, we can maybe control or alter. So what I focus on, even though we focus on all those lovely topics, is mostly sexual health. And this is still taboo in 2020. A lot of people don't want to talk about sex, even as adults. And so when it comes to teaching adolescents or teens about sexual health, it's really hard to get them to open up because they were taught not to open up about these things, right? Because they're just modeling what they see. So sexual health isn't always just about having sex, right? So with this slide, this one's a little bit older, so 2013, but we do see that more teens are delaying their first sexual encounter, right? But even so, if we go through this statistic, it says that about 65% of teens will have sex by the time they're 18 years old. It's a little less now, it's about in the 50-ish% range. So I get the argument a lot of times when it comes to parents or some caregivers of teens, why is sexual health important, right? Like why does my teen need to learn about sex? But if you see that eventually, my point is that they're probably going to have sex sometime in their lifetime, right? And so giving them the tools now will help them make the best decisions for their future. So, and like I said, sex ed covers a lot more than just sex. We talk about anatomy, we talk about consent, what a healthy relationship looks like. One of the quotes that I got from one of my students, which I like a lot, is that no one really teaches you how to love, right? You don't get a course on love or a healthy relationship. And same thing usually when it comes to sex, but a lot of times you just model it off what you see around you, whether it's social media, whether it's the people that are taking care of you. But if it's not modeled correctly or never talked about, how do you have the right tools to make the right decisions, right? And so that's where a lot of those disparities that we see in adolescence, especially when it comes to sexual health, comes from, right? And even other statistics or stigmas that we see with them is because they were taught not to talk about it, or they're maybe not taken seriously when they're talked about. So they're getting their information from the wrong place. Right. So some of the statistics that we see is that 1 in 2 sexually active Americans will contract an STI before the age of 25. So it's about 50% of the population will get an STI. So that's about 20 million annual STDs infections that occur among our youth. So even though adolescents and young adults only make up about 22% of the population, they do account for half of the STDs we see every year. So what is the most common STI in the US? This one kind of gets confusing sometimes to some people. I would have you guess in the chat if you wanted to, but. So we see a lot of times with young adults, especially college students, the most reportable will be chlamydia. However, the STD that's most prevalent is usually HPV. So we do have a vaccine for HPV, but again, because of that statistic, sometimes caregivers or adults think that, that is a sex vaccine, I've heard, so they opt out of it. So that education piece is not there. We also see a lot of times in young adults, gonorrhea, herpes, HIV, and syphilis. And then another one that's not on there is trichomoniasis. A lot of people haven't really heard of it until they end up getting that STI, but it is one of the most common STI, curable STI out there. And then when it comes to HIV, youth 13 to 24 have the highest percentage of undiagnosed HIV. And I live in Florida. So Florida, we used to be #1. Now we're, I think, #3, if I remember correctly, for new HIV diagnosis. So even though that they had the highest rates of HIV from ages 13 to 24, they also have the lowest rate of suppressants, which means that either that tells me that they may not have access to care, or they don't know how to get access to care, whether it's because of stigma, whether it's because they don't have access to medication because of the cost, et cetera. So that's some of the barriers that we see and that we work on, is trying to, if you are HIV positive, trying to get you into programs where your medication may be free or very low cost, because we do want your virus to be suppressed. In the United States, teen pregnancy is on the decline, but we still in the United States have the most teen pregnancies in any industrialized country. And one of the things that we do talk about in our classes is that even though we see that many teens are delaying the first time they have a sexual encounter, a sexual active teen who does not use contraceptive, whether that is condom or birth control, has a 90% chance of becoming pregnant within the year. And so that's why we want to make sure we give them the tools to make the best decisions, right? So this is one of the infographics I made for our youth, just to give them more information. I work in Sarasota County, so it's just comparing some of the rates to Florida and other counties. But one of the things that always gets them is the cost to raise a child in the United States from birth to 18 years old is about $233,000. And so they're always like, oh, I'm not ready to have a baby. That's too much money. But we want to, one of the reasons we want to help the teen pregnancies, I'm in our teen parenting program as well, teaching, is that only 2% of teen moms earn a college degree by 30. And that kind of keeps that poverty cycle going, especially once you realize the cost. And so trying to help them make the best decisions, even, once they have a child, is one of the things our program does. All right. And then even with those disparities, we see even more of a wider margin of error when it comes to young people of color and LGBTQ youth. They're more likely to be impacted by HIV, STIs, unintended pregnancies, and that's all because they may receive less care and less likely to receive culturally responsive sexual health services. Only 4% of LGBTQ youth were taught information about positive information in their health class for those issues, right? So if only 4% are learning information about how to best take care of themselves and their health, it's likely that there's going to be adverse effects to their health, right? LGBTQ youth are less likely to access healthcare when they need it, especially because of stigma. They're more likely to be homeless or insecure housing, more likely to smoke, and less likely to be physically active or on a good diet. So again, trying to change some of the education early to prevent some of those long-term chronic diseases later on in life that you guys were all talking about. So what challenges, why are we seeing all these numbers increasing? STI numbers are going up every year, even though planned pregnancies are stable numbers, they're still way more than we would like or anticipated, right? So what are some challenges? Why can't we prevent these things from happening? So I'm not sure if you guys know this, but if you want to guess, how many states require medically accurate sex ed? Meaning that the sex ed that someone is giving you has to be based on data, evidence-based data. All right, so if you look, only 13 states in the United States require the information to be medically accurate. So not many. I live in Florida, right? And so my state isn't even one that requires your information that you're getting in sex ed to be medically accurate, which means that one, anyone can teach sex ed, so you don't have to be a public health scientist. You don't have to be even an educator. Anyone is allowed to teach sex ed in schools. And so a lot of times that's another disparity that I see especially when I end up having college classes, is that someone gave them very wrong, inaccurate information. If you make this decision, then this will happen. It's usually like extremes. It's also not mandated. So Florida is another one that it's not mandated in, right? So it's not required that you actually get sex ed at all. So we do have a lot of students that I get that have never gotten any type of sex ed at all. Another reason that these disparities happen is because we have low rates of testing. Only 9% of high school students say they have been tested for HIV or other STIs. With that, that's why local health departments like mine are really important. A lot of times high school students don't know where to get tested. We always ask them when we're in class or wherever we are, like, where can you get tested for HIV or STIs? And they always say the emergency room or their physician. And so they're assuming when they get blood work done that they're automatically being tested for STDs, which isn't happening, right? Or they assume that if they're having symptoms, the only place to go is the emergency room, which I always tell them that's a huge bill and you're taking up a space for someone else. So let's just try to come to my office instead, right? But having that information, knowing exactly where you can get tested if you have put yourself at risk is really important. So if you don't know your status, we can't put you into treatment and care, and we can't educate you. And then the effect is you're transmitting your HIV or maybe STI to other people without knowing. We also have low rates of condom use. What we are seeing in young people is condom use is actually decreasing. So only 5 out of 10 sexually active high schoolers reported that they use a condom in recent sexual intercourse. And that's not a very high number, that's only half, right? A lot of times, especially with sex ed not being mandated or having to be medically accurate, they do take out a condom demonstration, or they just don't talk about contraception at all. And because of that, people don't know how to use a condom correctly. And so they don't use it. There's also stigma and misperceptions about sex. So we see that, fewer than half of high school students, which is about 43%, and only about 18% of middle schools throughout the country actually teach the recommended CDC topics on sexual health. So again, if you're at home, you're not talking about sex, or, in class, you're not teaching sex. When some problem comes up or you're curious, even about your body, whatever it is, you don't really know where to go to or turn for that information. And so you're having risky behavior and making maybe not the right choice. This is a slide. We actually just did our HIV presentation a couple weeks ago. And this is a slide that is all ages, but it's approximately 7 out of 10 of all people living with HIV in the United States are not virally suppressed. And this is what they're saying, why they're not in treatment. They don't have insurance. They feel fine. Taking meds is a daily reminder that I have HIV. I relocated, I can't find a new doctor, right? And so this is all ages. So if adults are having these problems, there's even more of a barrier if you are a young adult or a teen which just got diagnosed with HIV or AIDS. Another problem we see is lack of parent or peer support. A lot of times, a lot of my teens say that, or just teens in general say that they want to talk to their parents about sex. Parents are actually the most influential when it comes to teen sexual decision making. And so having those regular conversations about sexual health does increase the chance of someone making the right decisions for themselves, right? Or having someone to talk to. And then peer support can be different ways. I always tell them not to get like back of the bus information, right? Make sure your peer actually, took a class on sex ed. But a lot of times they're not getting the information from their parent. And so they're going to their peers for that support. And maybe those peers are people on TikTok or social media, and they may be spreading more information that way. So with all those disparities, what our program, Your Life, Your Health, Your Future does is try to eliminate some of the barriers when it comes to some of those things that we see in adolescent health, especially sexual health. So we're trying to give all the teens, like I said, the right tools to make the best decisions for their future. So with that, our goal or our initiative is to make sure someone is a sexually healthy person, which probably isn't what you think it means. It's one that they're educated. So knowing the information is the first start, right? Being able to communicate their needs and their wants. If they've had a sexual experience, being able to feel comfortable with that sexual experience. Knowing that they have rights, being able to advocate for themselves, whether it is with a partner or with a trusted adult, or if it's with a physician or a healthcare provider, being able to say, this is what's wrong, or this is what I'm having concerns about. being able to treat or prevent some of those things from happening that we talked about, whether it's a unplanned pregnancy or STI. Also, a complete understanding of how you fit into this world, how your body works, anatomy, all those things are equipped in having a sexually healthy person. And with that, right, a lot of times I have even adults that may not understand their anatomy or how their body operates. We get a lot of people with reproductive health I also work with, so pregnant moms, prenatal care, and sometimes we get on clinic days people that don't even understand like how they got pregnant. So having that information at a young age, making sure that everyone knows that information and so they're a sexually healthy person. So what our program includes is having medically accurate inclusive sex ed. So how we work is that even though we work with the Department of Health, we also partner with school health. So I'm in every middle school and high school for about 2 weeks at a time, rotating, making sure in their health classes or science classes that they are getting medically accurate inclusive sex ed. Also, we give free HIV and STI testing at the health department. So in the state of Florida, you only have to be 12 and up to get a free HIV and STI test without parental consent. A lot of times that's pretty shocking to hear that you only have to be 12 and up. But remember, our high risk group for new STIs and HIV is about 13 to 24. So I rather test people instead of waiting until they're 18, right? I always tell them I would love for you to have a trusted adult in your life that you can come get tested with or talk about these issues with. But again, like we said, not everyone has that. So I rather not wait until you're 18 to make sure you're getting tested. We also teach adult classes. So I teach a lot of classes to parents, community workers, physicians, nurses, healthcare providers, on the issues that adolescents or teens, young adults may have, right? So teaching about those disparities, teaching not necessarily just about sex, but human trafficking, mental health awareness, all those things, so they have a better way of interacting with their teens and telling them how they can better help them in the future. We also have a lot of community partnerships, making sure that at-risk youth are still getting the information, whether it's, Boys and Girls Club, Girls Inc., like things like that, as well as, free clinics in our area if they need us to come in and give seminars and testing as well. So some of the additional things that we also talk about or we see is period poverty. So this affects more than just young adults, right? It also affects older adults as well. But period poverty refers to the lack of access to menstrual hygiene or education, right? So we found that about 49% of people under the age of 29 will miss an entirety of school because of their period, right? So as we were in school, we were realizing that a lot of my teens, especially if they're minorities, were missing school for 3 or 4 days at a time every month, right? And so digging further into the problem, we realized that they were missing school because they didn't have access to tampons or pads, or they were just, maybe stuffing whatever they could into their underwear to have people not know that they were on their period just so they can go to school. So we implemented a program for them to get free menstrual hygiene products through either their nurse or they can directly access. And no questions asked, we can supply those things every month. So it's been very interesting, especially with COVID. A lot of the times, even beforehand, that young adults were, they were hoping that, their nurses or their teachers would be able to supply those things. And because they were out of school or virtual learning, now they don't have access to it. Early in the pandemic, a lot of people were hoarding period products. So even if you were able to go to the store, they weren't on the shelves, right? Or the price of them had doubled. Luckily, in Florida, we don't have a period tax, but it is something that happens in other states. So having this information, having people be able to talk to us about maybe not having access to stuff is also a gateway for us to talk to them about other things and educating them on sexual health, right? Right. And then last thing I was just going to say is one of the programs or one of the things that is really important to me that we talk about in sexual health is consent. It didn't show on that map, but consent is not required in most states to be talked about. Definitely is not a topic that is taught in Florida, but we added it in. A lot of times when we do talk about consent, what happens is that almost every time after class, I have at least one child come up to me and tell me that consent may not have been given in a certain situation. And so we know that every, I believe, 92 seconds, someone is sexually assaulted in the United States. And it could start at a young age, right? And again, we see that a lot on college campuses. But fortunately, with COVID, we're not on college campuses as much as we were previously, but we see a lot of those things happening because consent was never taught. And there's so many gray lines that people believe that are there. So don't have that much time now, but I'll drop this video in the chat. It's a really good video to explain consent to anyone of any age. So it's a great thing to check out in your free time. Okay. Well, that was it. If you have any questions, my email got messed up here, but that's the email. This is our website. If you're interested, we do free webinars for adults every month on different topics. This month is about homeless youth. I think next month we have things on human trafficking and how to have self-care, mental health. So if you're ever interested in any of a free webinar, just visit our website or email me and I can connect you.
Wonderful. Thank you, Ms. Thompson, for educating us. Any questions, anyone? Please do raise your hands if you have any questions, or you can drop them in the chat, and Ms. Thompson will have a go at them. No questions yet?
I want to ask, but my dog is barking, so I'm going to put it in the chat, okay?
It's okay. We're not hearing him or her. Go ahead.
My question was about, you can hear or no, right? My question was about the consent and educating parents about the consent itself. One thing that I have heard a lot from parents is they just don't know how to describe the consent to their, especially their young girl children, because consent is on so many different levels. So I know you said you were going to drop the video into the chat, but I didn't see it in the chat. So I was just wondering if you could just, be sure to put that in the chat for all the parents out there, because I think that's something that they would definitely want to check out. Thank you.
Right. Yeah. That's something I hear a lot. I'm dropping it in the chat now, but it starts really small or when they're young, right? So if they don't want to hug someone, just not forcing them to hug someone, or if they don't, want to give give someone a kiss on their cheek or something like that, letting them know like it's okay that you don't have to if you're not comfortable. Just small things like that, or before I'm gonna put on your shoes, is that okay? Things like that, just to reiterate that no one's allowed to touch your body without your consent, and then you gradually grow on that.
Thank you so much for that.
Okay, and just sharing a little experience here, especially for younger children, much like what Alexis just said. Just teaching them that no means no. you know, and it doesn't matter in what circumstance, whether it's giving or receiving, no, there's no new meaning for no, it's just no. So that was one of the tidbits I picked up along the way. We have a question from Carl Miller. Carl, go ahead and ask your question.
Hi, thank you for that presentation, Ms. Thompson. It was very, sorry, can everyone hear me?
Yes, we can.
Okay, great. Thank you for that presentation, Ms. Thompson. It was very informative and I think very relatable in a lot of ways, especially now with the pandemic. A lot of people are spending more time, I think, with age groups of siblings, of cousins, of people who are now spending more time at home in some instances, and parents are now spending a lot more time with their children. So getting this kind of information out there, I think, could definitely come in handy. On the topic of period poverty, I was wondering about what its effect, or for lower income households, they would be, I would think, more detrimentally affected by the one, lack of sexual education, and also the additional cost of these items. So a lot of, I've noticed, at least locally, there have been a lot more initiatives for collecting and just giving out the, whether it's pads, tampons, whatever menstrual items are required. So what do you think would be an, I think, an effective stopgap for households who are having these kind of issues to do with education and obtaining the items?
That's a good question. And again, like menstrual hygiene and periods are still a taboo topic just with sex, right? So a lot of people won't feel comfortable talking about it. So there's a lot of people advocating for policy changes, especially at least in the States, for period products to be free, especially grants and stuff for them to be given out in middle schools and high schools for free to help with that gap. Also helping with having more sex ed, having that as a factor, making sure that they are talking more about menstrual hygiene, menstrual education. I know a lot of times, like especially with the pandemic, I had young girls messaging me or reaching out to me because their cycle had changed and they were worried and not realizing that just stress is going to change, you know, your cycle because no one really educated them on that. So we started doing like virtual education that's open to anyone if they want to learn more about menstrual health, and it's open to all ages, especially when we talk about people of lower income. They are going to be more effective with maybe not being able to buy those period products. So especially that disparity, we try to reach out to those schools, those neighborhoods, and see if we can provide that with them, for them, no questions asked.
Wonderful. Any other questions? All righty. So if participants, if you have any more questions, just drop them in the chat and I'm sure Ms. Thompson will get on them. Thank you so much again, Alexis. We appreciate the education and for directing us to the right places. And for those of us who are parents, having an idea how to go about explaining things to the adolescents that we have in our lives.